Hi guys, I am Dr. Nyasiabonnett, the nurse doc tutor, and today's lesson will be on how to answer case study questions. So, if you are new to this channel is dedicated to helping you guys pass nursing school or to help you pass NCLEX. So today's lesson will be on how to answer case studies. All right, you guys. So some case studies will pop up on the screen. If you want to answer them by yourself, all you have to do is just pause the video and then answer the question and then press play and we'll go over them together. So let's go over some important information before we go into our examples. So first I'm going to talk about how to dissect the case study. So I'm going to be a party pooper and start it off by saying you need to read the entire case study. I know that you think you are good with picking out the most important information, but let me be the one to tell you, you're not. There is information hidden in the smallest little details, so you need to read the entire case study. After you read the entire case study, now let's move on to the tips on dissecting it. So first you want to read the question, then read the case study. That way you have a good idea of what you're looking for while you're reading. So then you want to note pertinent information such as age. Remember, as the patient age goes up, the body systems tend to slow down. And also think about our infants. As the younger you are, your body is not fully developed. So those are things you want to keep in mind. Also, paying attention to objective and subjective data. Drowsiness. Does the patient report fatigue? Are you seeing an increase in their heart rate? Do you see pale skin? Have they report a lack of appetite? And while you're looking at all these signs and symptoms that this patient is going on, is there a specific disease process that is coming to your mind? So as you start to see different signs and symptoms, the wheel in your mind starts to turn and say, hey, this could be high blood pressure. This could be asthma, because this looks like signs and symptoms of a patient that could be presenting with this disease process. Also, you want to look at your time frame. Case studies love showing you what happened at 12 o'clock and then telling you what happened at 2 o'clock. You need to look at that time frame, and you need to be looking at the interventions that are done within that time frame. All right? You also want to look at your lab tests and values, and it's not just enough to know if it's high or low, because guess what? They have been so gracious to let you know if a lab value is high, if it's low, and guess what is the normal ranges. But what's going to make the difference is, do you know what this test actually means? Now that the lab value is high, I let you know it was high. Now, what does that mean? Do you know what lab value does this test even stand for? What function is it testing? So like your BUN and your creatinine, that's your kidney function. Do you even know that? So it's not enough to just know your lab values are high and low, but being able to actually get the wheel turning and is to start critically thinking. All right, and medications. Then you want to answer the question. All right, after you answer the question, while you're answering the question, you want to make sure that you're only focusing on one answer choice at a time. This is not your typical A through D nursing question, but you could have A through F. There are so many option choices, so you want to make sure that you're only focusing on one at a time. And I noticed that when you focus only on one answer choice at a time, guess what? Your anxiety goes down and you're not overwhelmed. And you normally make the right choice when you're not overwhelmed. So you want to take them one answer choice at a time. So the following question reads, a 12-year-old client visits the healthcare clinic for a follow-up visit after laboratory and other testing. The client is accompanied by a parent. The client tells the nurse about an increased appetite lately and about urinating more frequently than usual. The nurse reviews the client's test results and collects data from the client prior to the client being seen by the physician. The following is documented in the medical record. So I'm going to read the question now. For each body system, click to select the priority client need to prevent a complication of the client's health problem. Each body system supports one priority client need. Now let's go back to the nurse's note. So we're looking at the patient's vital signs. Temperature of 98.2, heart rate of 78, blood pressure 118/70, respiration 16, oxygen 96 on room air, and the patient reports no pain. Their skin is dry and intact and warm. Respiratory, they have a dry cough. They report sputum and is white and thick mucus following respiratory treatments. Their lung sounds are clear when you're listening to them. GI, they have an increased appetite. They report taking pancreatic enzymes with all meals and snacks. And their bowel signs are active, times 4 quadrants. Regular bowel movements, they are brown and fatty. And their weight is 41.5 kgs. Height is 59 inches. And the patient states that the client was diagnosed at 3 years old with cystic fibrosis. So, take a break because guess what? That was a lie. All right, so now we're going to go back to the question. So let's read the question. It says, for each body system, click to select the priority client need to prevent a complication of the client's health problem. Each body system supports one priority need. So we're going to go through each body system and which is priority. That means which one is most important. So in our respiratory, it says an oscillatory positive exploratory therapy or oxygen administration. So let's think about it. Which one are we going to choose? So we know that for sure this patient is dealing with cystic fibrosis. So did you pick that out as a key thing that you need to remember? That this patient has cystic fibrosis. So you can then go back under the tab of respiratory and see what's going on in that respiratory with the patient's respiratory system. So that patient has a dry cough and that patient has some white mucus coming up, white thick mucus coming up, but that patient oxygen is 96%. So does that patient need oxygen if they're 96 on room air? No. But could the patient benefit from a PEEP therapy if they are having white thick mucus? Yes. So what is a oscillatory positive expiratory therapy? That is a little machine we can give the patient to blow in and breathe in so that they're able to mobilize those secretions. So we want to mobilize those secretions so that patient can be free of mucus. So you see how important it is not to know what cystic fibrosis is, but it's also to know what your oscillatory positive expiratory therapy is. Because if we didn't know what that was, we wouldn't have been able to answer this question. All right? But we would have been able to with the process of elimination, knowing that this patient did not need any oxygen because they're 96 at room air. Let's go to the next body system, GI. So we look in the GI section in our nurse's notes. It says that the patient has an increased appetite and reports taking pancreatic enzymes with all meals and snacks. Bowel sounds are active and they have regular bowel movements that are brown and that are fatty. So which is priority? A low-fat diet or pancreatic enzyme therapy? Let's think about it. So this patient has cystic fibrosis, meaning that they do not have those pancreatic enzymes that they need to for digestion and for absorption of nutrients. So a patient needs to always take their pancreatic enzymes. Those are very, very important. So that's going to be priority for this patient. So the diet for our cystic fibrosis patients, we're going to want them to have a high protein, high calorie diet. And guess what? Their fats are going to be unrestricted because of the impaired intestinal absorption. So this goes to let you know that guess what? Diets are very important. Diets are very important. But in this problem, you need to know that pancreatic enzymes are important. So important. All right, so let's move to the immune system. All right, so would you start the patient on antibiotics just prophylactically? Or would you put the patient on contact precautions with separations from other CF, cystic fibrosis patients by at least 6 feet? All right, so we're reading through the nurse's note. We look at the diagnostic test, and it says that the chest x-ray just showed mild lung hyperinflation, no chest infiltrates, no atelectasis. So why would they need to be on an antibiotic? Let's make sure we're crossing all our T's, and we're going to skim through the rest of the problem. But nothing says that this patient needs to be on antibiotics, right? And we don't want to put patients who are chronically ill, we don't want to be putting them on antibiotics for just any type of reason, because guess what? They will build up resistance into when they need an antibiotic, it's not going to work. So one of the biggest things with our cystic fibrosis patients is making sure that they are free of infections. So we want to make sure that we're teaching their family and teaching the patients how to prevent infections. So if they are in contact with another child who has cystic fibrosis, we want to make sure that that child is not sick, because we don't want to cause a cross infection. So when they are around another child with cystic fibrosis, we want to make sure that there are contact precautions in place, because we don't want there to be cross infection. And it's not that we that these patients don't need to be around other CF patients or their friends, but also, like I said, you need to be teaching them infection prevention at all costs. So this patient may wear masks everywhere they go to prevent infection. So infection prevention is so important in this patient population. All right, so let's move on to our endocrine system. So it says insulin administration, or we could have a human growth hormone administration. All right, so let's look at our diagnostic test. So we see that the patient has a glucose of 240 mgs per DL. So, and that was 2 hours after administration of a glucose liquid. So 2 hours, and their blood sugar is still pretty elevated to say it was 2 hours ago. So patients who have CF are at risk for CF-related diabetes. So we looked at our blood sugar level, and our blood sugar level is high. So guess what? Insulin administration would be appropriate in this setting. All right, so the final part of this question is the integumentary system. All right. So it says that would you do high sodium foods or oatmeal baths? So we're going to check our nurse's notes. And the only thing that we see on the skin is that the patient's skin is warm, dry, and intact. All right, so it doesn't give any details on there. But we know that when we're dealing with cystic fibrotic patients, that these are our salty patients. That these are our salty kids, where we're going to taste a salty kiss from them. So these patients excrete a lot of sodium and chloride in their sweat. So we want to make sure that we're giving them foods that's high in sodium to keep up with what they have pushed out. So you see how it is so important that you have an understanding of different disease process, because you see how they dig so deep into this this question. And if we didn't know anything about cystic fibrosis, we would not have been able to answer this question successfully. So this question is just a reminder of how deep this NCLEX wants you to be able to think. So you need to make sure that you are reading and understanding your disease processes. You cannot memorize anything. You have to be able to understand how these disease processes work in order to answer these NCLEX questions. The question reads, a 78-year-old client has been hospitalized for the past week for evacuation of a subdermal hematoma after a fall. Immediately after surgery, the client was alert and oriented with right-sided hemophoresis. The client's speech was slurred, but the client could communicate needs without problem. The client was continent of bowel and bladder most of the time and began rehabilitative therapies. On the third post-op day, aspiration pneumonia was confirmed by x-ray, and the client was placed on IV antibiotic therapy. Today, the nurse reviews the last entry in the nurse's notes for an update on the client's condition. So drag or select the client findings from the choices below to fill in the blanks of the following sentence. The nurse reviews the notes and recognizes that the client findings that are of immediate concern are. So we're going to look at the client findings, and we have to choose 4 that are of immediate concern. So 4 priorities. Now let's go back to the nurse's note. So at 7:30, the client was very drowsy this morning, but can be aroused with gentle shaking. Is that normal? Their client remains alert and oriented times 3. They do not readily respond when spoken to, but eventually answers 1 to 2 words. No adventitious or decreased breath sound. S1 and S2 are present. No additional heart sounds are heard. Bowel sounds are present in all abdomen areas, and the abdomen is soft. The patient had 2 incontinent diarrheal stools during the night. They were able to move all their extremities, but their right arm continues to be weak. The skin is intact. No reddened areas are noted. Plan to see PT and OT this morning. The patient has a temperature this morning which increased from 98 to 100.2. So let's go back to the problem. It said the nurse reviews the notes and recognizes the client findings that are of immediate concern. So now let's go to our client findings. So we know we can choose 4 priorities. So now we're going to take each answer choice one at a time. So, are you concerned about this patient drowsiness? Is that something that we should be concerned about, that patient drowsiness? Yes, because we read early in the case scenario that the patient was alert and oriented, right? And we read now in the nurse's note that the patient does not readily respond, that you had to gently shake the patient to wake them up. That's not right. So this would go over here. Drowsiness could go over here. All right. No adventitious or diminished breath sound. Hey, that's not a concern. Why? That's a good thing. All right. Right arm weakness. Are we concerned about that? No. We are not concerned about that because guess what? The patient came in with that. That patient had a subdural hematoma and they were left with that. So we're not concerned with that. Are we concerned about bowel sounds time 4? No, that's good. We are glad they have their bowel sounds. Now, are we concerned about incontinent diarrhea stools? Yes. And the biggest thing to note is that it says incontinent. As we read earlier, it says that the patient will be both continent of bowel and bladder. So now, all of a sudden, the patient is incontinent and having diarrhea. No, that is a concern. All right. How about their speech ability? Are we concerned about that? Yes. Because as we read early on, the patient was able to communicate their needs without problem. Now they're only answering in 1 to 2 words. That is not normal, and that is not normal for that patient. So you always want to compare the patient to their baseline. So that's why you have to read the entire case study so you have something to compare it to. Do you see how I go from the case study to the nurse's note, the case studies into the nurse's note? You have to read the whole thing. All right, and are you concerned about the elevated temperature? Yes, because this patient didn't have a temperature, now they do. All right, guys, that is a wrap on today's lesson. I hope you have learned something. If you have any more problems and have any more questions, guess what? My information is listed right on the screen right now. Either email is fine. The phone number, you can call or text it. If you aren't following our Facebook group, guess what? You should, because in that group, we go over some good stuff. Daily NCLEX questions, study tips, test taking tips. We go over so much in that group, and I would love for you to be a part of it. If this video has increased your knowledge, guess what? Share it with your fellow nursing students. If you're not in nursing school, share it with a student that you know that may be struggling. Let's all learn together. This channel is dedicated to helping you pass nursing school. I will see you guys in the next lesson. Have a great day.